Okay, so first I'm going to knock on the door, enter the room. I'm going to perform hand hygiene. And I'm going to ask the patient yes or no questions because obviously they cannot talk. So what I'm going to ask is for them to verify their name and date of birth by asking them their name and then yes or no, asking them their date of birth and yes or no. And then I'm going to ask them if they have any like latex allergies, and then if not, any other allergies that are known. Then I will go ahead and set out my suction. I will have my ambu bag ready, and I have the patient draped for any excess drainage or anything that could fall on them. And then I'm going to go ahead and perform a respiratory assessment. And then I'm going to set that to the side so that it doesn't dangle. And then I'm also going to put a pulse ox reading onto their finger so that I can continuously monitor that throughout the procedure. So then I'm going to go ahead and put on my PPE. I'll make sure that's good and tight so that it's not falling. And then I'm going to go ahead and perform hand hygiene once more. And like I said, I have my patient draped and boo bag as well as suction laid out. Set that to the side. I'm going to open up my container. I'm going to get my sterile gloves out. Make sure my hands are good and dry. And then I'm going to, no, that's the wrong. It's backwards. But I'm going to don my dominant hand, and then I'm going to don my non-dominant hand. And now that I have those, I'm going to keep them above waist level. Move that to the side. And from here, I'm going to scoop this over. I'm going to wait and get that out after I open this. I'm going to open this up, set that in there, dispose of that. I would use that in a trash can, but we're going to be reusing these later. So just, that's my trash can for now. And then I'm going to get this out, dispose of that. And I'm going to put this between my pinky. I'm doing this backwards. Between my pinky and this finger. And then I'm going to grasp it. And these gloves are huge. And then I'm going to be breaking my sterile technique in my non-dominant hand. So I'm going to grab the suction, hook that up to suction. And then I'm going to test suction, which I would run continuously at 100 to 120. And then I'm going to test that in my saline. Get that again. And then I'm going to, give 5 breaths. 3, 4, 5. So that I can over-oxygenate my patient. Pulse ox is good. And then I'm going to hold this like a pencil, going straight in, not touching the sides, until I feel resistance or until the patient feels like they're going to cough. And then I'm going to do 3 things, which is back out, swivel, and do intermittent suction. Okay, and then I'm going to contain it once more, give 3 breaths, and then I'm going to suction through that again. You can do that up to 3 times. It should take no longer than 10 to 15 seconds each time you do it, but we're going to say that the patient's airway is cleared. And then I'm also going to go ahead and give 5 more breaths since we're done. 5, And then I'm going to take my non-dominant hand that is contaminated, and then I'm going to remove this, dispose of that. I'm going to unhook my suction, remove my gloves, dispose of that in the trash, and then I'm going to take the patient off the ambu bag, replace the trach collar, and run that at 100% of oxygen until I do my trach care, and then I'll document.